All right, so at this time, I would like to introduce the 4 guest speakers that we have from the United States Department of Veterans Affairs. First, Stefan Waith, who will be talking about VA enrollment and healthcare access. Secondly, Ms. Heather Mitchell. She's going to be talking about the VA's Community Living Center, hospice, and palliative care. Josie Dean is going to be talking about hospitalization and discharge planning. And last but never least, Miss Jackie Adams, who I've had the pleasure of knowing for many years now. She is going to be providing a briefing on the VA Caregiver program. And I see that we have some folks that have called in. So Stefan, are you on from a phone?
Yes, good morning. Can you guys hear me okay?
Yes, yes, I can. Thank you so much. I'm going to go ahead and give you the floor. Thank you.
Okay, great. Good morning, everyone. My name is Stephen Waith, and I'm a social work supervisor down at the VA Maryland Healthcare System. So I work over in our primary care clinic, or PAC clinic, as it's better known as, and I've been with the VA for about 6 years now. And so originally, our Assistant Chief, Ann Hall, was going to give this presentation, but I agreed to step in for her. And so this is going to be a pretty brief and simple snapshot about the enrollment process, a little tidbit on eligibility, and then some of the services that are available through the healthcare system for our older veterans and veterans in general. So I'm sure there may be a good amount of questions at the end, so I'm going to try to save some time for that. So to jump right in, in the VA, I'm sure you guys know on the MDVA side, we love our acronyms and our various shorthand for things. And so there's a couple of terms I wanted to go over that I'll use throughout the presentation. So the first one is VAMX, and that's just me referring to our VA Maryland healthcare system. The VA hospitals across the nation are pretty unique, where each state has a different setup about kind of how the clinics are managed. And so for us, we're a healthcare system in the state of Maryland because we have a couple of medical centers and then a couple of community-based outpatient clinics. And so that takes me to my second acronym, which is CBOC, and that just refers to our community clinics throughout the state. Another term I'll use a lot is PACT, and that stands for our Patient Aligned Care Team. So the PACT is a care model that our VAs use for primary care, and it consists of a primary care provider, which is either a physician or a nurse practitioner. We have a couple of nurses, RNs, LPNs, some various support staff, program support staff, medical support staff, a pharmacy tech, a dietitian, and a social worker. And so whenever I refer to the PAC team, it's usually those providers there. The other thing we'll refer to a couple different times is VA Service Connection. I'm sure many of you guys are pretty familiar with the service connection process and disability ratings, but basically just referring to an illness or injury that a veteran would have sustained either on active duty or on active duty orders, and that they've applied for benefits for that. And the last term I may throw around is VSO. As you guys know, that's just for Veteran Service Organization. Okay, so jumping into the presentation, in order to talk about enrollment in the VA healthcare system, we first have to touch on eligibility. So as many of you guys may know, VA healthcare is not an automatic process. It's something that veterans have to apply for. Our younger vets have the luxury of having a transition process where when they're getting ready to exit active duty, they're usually encouraged to join VA. They may have special events about enrolling in healthcare, and there's even a transition program designed to help some of those veterans get into the system. But for some of our older guys, our Vietnam, Korean War era veterans, there wasn't really that automatic process set up. And so a lot of them either didn't know about VA healthcare, didn't know how to access it, or didn't know they were eligible. That being said, though, not all veterans are actually eligible for VA healthcare. Eligibility is a pretty kind of nuanced process, and any specific questions we usually defer to our enrollment and eligibility office. But usually there's a couple different categories that would make a veteran eligible for healthcare. That's if they already have a VA service-connected disability rating and a certain percentage of that. Their service history and military records, so they have to serve at least in most cases, 24 months of active duty. If they have a pretty significant medical injury or illness that's not service connected, but at the administrative level of the local hospitals, they can be admitted healthcare for that. And then we are an income-based hospital, and so some veterans cannot be eligible based on making too high of an income. And income actually also determines our different priority groups, which determines things like co-payments and what services they would be eligible for. So, like I said, a lot of different nuance in there. But once a veteran is determined to be eligible for healthcare services, there's 4 main ways for them to actually enroll and register. The first one is by phone. And so we have a national enrollment office and number that veterans can call, but we also have local numbers. So here at the VAMEX, we have a local number, and then as different states, they should usually have a main medical center number that veterans can call to enroll over the phone. The least preferred method, I think, is probably by mail. The VA still loves their snail mail system, so veterans are able to mail enrollment application and wait for response there. I'd say I see more often now online registration through va.gov. Caregivers, veterans, and family members can submit their packet there and any documents they may need. And then we also have enrollment offices at our main clinic that veterans can go in person, sit down with an enrollment specialist, and enroll for healthcare. The enrollment process is, I think it's fairly straightforward. There's a couple of things that veterans will need to come with or have available to them when they're trying to enroll. Some form of income verification. That's often like a tax return, W-2, maybe a award letter from the VBA, the Benefits Administration, or the Social Security Administration. They will also need their Social Security number for their spouse, and any dependents they're claiming. The VA does accept supplemental health insurance. So if a veteran has any outside health insurance, they can give that information to the VA. Also Medicare information, and then some sort of military discharge documents to confirm their time of service. So it's usually the DD-214, but there are some other documents that the VA will accept in order to, confirm those. So that's just, like I said, kind of a lot of information, but that's a brief snapshot about the enrollment process and then some things about eligibility. And so then we look at, all right, I'm a veteran, I've submitted my enrollment application online, I've got a letter that says, hey, you're eligible for VA healthcare. Where do I even go, or how do I get started with that? And so, like I mentioned earlier, here in Maryland, we have a VA healthcare system. So we actually have 3 medical centers. We have probably our largest one down in Baltimore on Green Street. We have a medical center up in Perry Point, or Perryville, Maryland. And then we also have a medical center in Loch Raven. We also have 5 community outpatient clinics. We have one in Eastern Baltimore County. We have one in Glen Burnie, one on Fort Meade, which is different than Fort Meade's medical clinic. And then we have 2 out in the Eastern Shore in Cambridge and Pocomoke City. And so we have each of those clinics has like a main number you can call, and really the first entry into access is to schedule a primary care appointment. And so once a veteran kind of calls that appointment line, they can actually choose any of those facilities they want based on, if they want to be closer to one, maybe they are more familiar with a provider or something like that. But any of the facilities based on the veteran's choice, and that's kind of the VA as a whole. So once a veteran's enrolled in VA healthcare at one state, they can actually access any state based on having their registration information forwarded to that local VA. Let's say I'm driving from Maryland out to California and I want to stop for VA healthcare on the way. I am eligible to do that as a veteran. Another access point outside of the medical clinics and CBOCs are that we actually have a home-based primary care program. Pending a referral from a primary care provider, veterans can get primary care visits done in their home as indicated. So usually they may be homebound or have extreme difficulty leaving their home, or there's a medical condition or a provider may say, hey, it's probably in your best interest to not come back and forth for medical treatment. A fairly newer, robust program we have is also veterans can get care in the community through VA healthcare payment. So that's a pretty complicated process. So I'm not going to get into too much, but through the CARES Act, veterans now can receive urgent care through some community partners. They can receive emergency care through some community partners, and specialty care either through referral from a VA provider or in some cases pre-approval from some other source. But I mentioned before our kind of PAC team model or healthcare model. That's really the bread and butter of our VA healthcare system. If anyone out there is familiar with on the private sector, like a Kaiser Permanente, our model is pretty similar to that. And so all things usually start with your primary care provider and referrals out to things like specialty care. We also have some specialty PAC teams. So these are teams that are cater to a specific veteran population. So we have our HPAC team, which is for our homeless veterans. We have our SMI PAC, which is for veterans who have a severe mental illness diagnosis. We have our GeriPAC team or geriatric team for veterans who are 65 and older and have some of those, more complex, elder needs. We have a comprehensive women's health program, and we're actually, you guys alluded to the state and Women's Veterans Day and stuff like that. And so the VA Nationals made a big push for trying to really encourage our women veterans to enroll in our women's health PAC team and to work with those providers. We also have our home-based primary care PAC team, and then lastly, our infectious disease PAC team. So for each of these PAC teams, veterans actually have a social worker, and that social worker is really there to help them with system navigation and care coordination. You guys may have heard veterans allude to, hey, I'm trying to get a hold of my social worker, or I heard I have a social worker at the VA. Most of the time they're referring to these PAC social workers. They're kind of like the jack of all trades. They know a little bit about a lot of different things in the healthcare system, and that's actually where I got my start in the VA. And so they tend to be a good primary point of contact for veterans, for family members, for VSOs, for anyone who has questions about, hey, I have a veteran in this situation. Where can I send them? What can I do with them? And so, specialty care at the VA, once that primary care doctor is established, veterans usually have access to anything from the eye clinic, audiology, routine gyno care, mental health, derm, palm, just the whole spectrum. There are some services now that don't really require a referral, which means that veterans can call these clinics directly and schedule an appointment. So that's like an eye clinic, if they want like hearing aids or evaluation for that. And then our mental health clinic has its own kind of triage process there. Before I jump into some other things, I will take a little break and see if anyone has any specific questions about anything that I've mentioned so far. And unfortunately, I wish I could see the chat box or anything like that. So I'll take a brief pause to see if anyone has anything specific about what I just talked about.
Yes, sir. My name is Bill Anderson. I'm the HR director for SSTAT. So one of the benefits that we have for veterans is that we give, if they are 100% have disability, that we'll relieve them of their state taxes. But two things have to happen. One, they have to have their DD Form 214, and the other one that they have to have is their VA rating that shows that they're at 100%. Now, sometimes they have it, sometimes they don't, but normally speaking, if we were able to have, if they had the letter, then we'd be able to sign off and be able to move through the process. If not, then we got to send them to you guys at the VA in order to get one, in order to come back, and it's just more red tape. So how can I best tell the veterans the best way to get a hold of that letter if they do not currently have one?
Okay, so that's a great question. And so this actually brings me to a little bit of a wider kind of introduction to the VA. So the VA as a whole is actually three legs of an umbrella. We have the Veterans Healthcare Administration, which is us on the hospital side. We have the Veterans Benefits Administration, which is the part of the VA that handles all of those service connections and financial awards. And then we have the National Cemetery Administration, which manages a lot of the postmortem benefits. And so obtaining an award letter from the VA, really what a veteran would want to do is get a hold of the Veterans Benefits Administration. So there's an 800 number that they can call, and really they can just request an award letter. One of the options on the phone is for that purpose. Also, we have in Baltimore, Maryland, we have a regional office for the benefits administration located at 31 Hopkins Plaza. So, you know, pre-COVID, oftentimes veterans would walk in there and request that award letter. Sometimes they'd be able to get it that day or they'd have it mailed out. But whenever a veteran already has that rating and they don't have a copy, that's usually one of the quickest ways. My personal opinion is the best and easiest ways for veterans to log on to ebenefits.gov, which is the VA benefits portal. You know, some of our older veterans probably don't initially make a profile there, but if they create a profile there, they really have access to all the things related to their benefits. They can apply for some supplemental benefits and resources. And so I would direct them either to calling the VBA to request that over the phone or logging onto the eBenefits website to get that information.
Okay, thank you.
And Bill, I just want to mention also the main office for our service program is inside of the regional office at 31 Hopkins Plaza that Stephen just mentioned. Phil Munley, the director of our service program, has a really great relationship with the benefits administration. They're all just one floor apart from one another. And if it's a matter of needing to get that application signed off on, what we've been able to do is have veterans scan and email the application to Phil, and Phil physically walks it down to VBA and gets it signed, and then he sends it back to the veteran. So that's another option as well.
Yeah. One of the things, Dana, we've done is that we put into procedures into, if they come with both of those things, we won't even have to go to the VA for them to sign the bottom of that form. We're able to sign off verifying the two forms. So it's just a matter of being able to get our hands on both forms.
Yeah, that's great. That's fantastic that you'll accept the award letter in contrast to needing that signature. So that's really good news.
Yeah, so we're just trying to streamline it a little bit in order to help them out in the process. And each county is different because they can look to sign off on the date that it was actually awarded, or the county, depending on what they're doing, it'll do it the date that was applied. So they'll take the retro back, which will help them out on their taxes as well.
Yeah, that's awesome. Other questions for Stephen before he continues?
Yes, I have one. Can you hear me?
I can.
This question is for Mr. Wade. We're being told, my name is Mark Mendel, I'm with the Maryland Department of Labor Veterans Program, that a lot of the links on the eBenefits website are getting diverted to the VA website, and at some point in time, the eBenefits website will be shut down because we're telling folks, or we're being told to tell folks, to go to the VA website to get a lot of information that was previously available on the eBenefits website. Can you shed any light to this?
Hey, so unfortunately, I don't know much about kind of what's going on with the eBenefits website. I would say it's not uncommon for some of those links to defer to the general VA issue. But what I will say is that if there are specific questions or situations, we're always open for you guys to give us a call down at the VA at our main social work. And so I'll list that number here, and hopefully one of my colleagues can put it in the chat. But whenever you guys are having like a specific question and maybe you're having trouble navigating the website and it's something that is either healthcare related or you're just trying to get a hold of someone in real life to talk to, we're always open to receiving those calls. And so our main social work line down at the VA Maryland system is 410-605-7281. So, you know, you guys, please feel free to reach out about some of those things. And, you know, without knowing the specific situation and specific link, I probably can't tell you much, but offline, I'd be more than happy to kind of go through some of that stuff with you guys. And so with that being said, in the interest of time, I'm just going to wrap up with some of our kind of top 3 services that we find some of our older veterans requesting and caregivers requesting through the VA, you know, on the healthcare side. And so, you know, for veterans who are eligible for healthcare, they're also eligible for some geriatric and extended care services. And so one of the main ones is our adult day healthcare program. where veterans are eligible for 2 days a week of adult day care services, usually to assist with like social isolation, helping veterans kind of get out the house a little bit, and really providing a little bit of respite for the veterans' caregivers. The other big program we have is our home health aid program, where the VA can supplement usually up to 10 hours a week in home health aid services for ADL care. So things like bathing, dressing, grooming, feeding, toileting. This is probably one of our most used programs for our veterans who live with maybe by themselves or with one caregiver, and the caregiver is not able to manage that care by themselves. And then the last service, which is really more of an umbrella service, is our respite care. And so for veterans who are service connected at 70 to 100%, they're eligible for inpatient respite care, either our Lock Raven or our Perry Point campuses. And that's usually about respite care for about a week. So, caregivers who have a planned family vacation, maybe once a year, they know they have a trip to go visit someone else, and they want to make sure that the veteran in their life is cared for. They can apply for the respite program. We also do an in-home respite program for our veterans, which, every veteran is eligible for 30 days out of the calendar year for in-home respite. I will say that 1 day counts for 6 hours. So it's not a 24-hour day, it's a 6-hour day. And that's for anything from the non-skilled care to maybe veterans who have more comprehensive care. For any of these programs, and actually for all of them, they require referral from a veteran social worker or their PAC social worker. So that again is where a veteran having a primary care provider is the first step. Then if they need additional services, getting connected to their PAC social worker can help kind of offer more information about these and then submit the referrals as appropriate. And so with that, I'm going to end to give my other colleagues a little bit of time to share, but I am willing to field any additional questions about maybe healthcare related things, if there are any.
Thank you so much, Stephen, and I'm so sorry for mispronouncing your first name. Please forgive me. I haven't had my second cup of coffee. Any other questions before we move on? Cameron, yes, I will share contact information in the notes that I send out after the meeting. And thank you to Heather for putting all the great contact numbers in the chat. So I'd like to move on. Ms. Heather Mitchell is going to be talking about the VA's Community Living Center, Hospice, and Palliative Care. Heather?
Okay, you can hear okay?
I can.
Okay, good. I know my colleagues are having trouble. They're all working on site, so our firewall isn't allowing Google Meets to cooperate with them, but I am working from home today, so I'll be throwing some of the information into the chat for you. As Dina said, my name is Heather. I am one of the assistant chiefs of social work into the VAMX. I work with our community living centers, our hospice and palliative care program, as well as our workplace violence prevention program. So I'm going to focus on 2/3 of my job for you this morning. And Steven did a great job kind of segueing to me, because my programs tend to take care of those veterans that can no longer be taken care of at home. So if those programs that Steven discussed aren't quite enough, we then step in and take care of them as long as they're eligible for the programs that we have. So Community Living Center is our terminology for our nursing homes. We have adopted Community Living Center to make it feel more like home. We do consider our facilities residents' homes. The veterans live there. And we try to make it as home-like as we can. We do have 2 facilities here in the VAMX. One is at the Lock Raven Medical Center, so it's right off of Lock Raven Boulevard. The other one is at Perry Point in Cecil County. Between the 2 sites, we have approximately beds that fluctuates based on a number of different things, but that's kind of where we're sitting right now. We offer multiple levels of care, so we do have short stay and long stay residents. So some residents come to us just for rehab following a long hospitalization or surgery or something along those lines. Others come to stay with us. So we can do post-acute, we can do skilled care, things like IV antibiotics or wound care that can be managed at home. And for those two, the goal is to get them back home. If they require a higher level of care, we then work with them to maybe stay with us for longer term in our nursing home units. Our requirements for eligibility for LCs are that the veteran be 70% service connected or higher, or that they require nursing home care for service connected condition. They also have to, or it's required that they need with at least 3 of their ADLs. So 3 of their activities of daily living would, things like dressing, eating, bathing, toileting, transferring, those kind of things. They need help at least 3 of those, they would be eligible for our long-term care units. We have, as recently as yesterday, started taking admissions again from the community. COVID kind of slowed us down with that. We were only taking admissions from our acute medical center at Baltimore. We are now accepting admissions from community hospitals and from home. So we're really excited about that. Our referral process kind of depends on where a veteran is coming from. So if a veteran is in a community hospital, we ask that the social worker or discharge planner there contact our admissions coordinator. Our admissions coordinator is Kelly Grandy, and I'll put her contact information in the chat. If a veteran is coming from home, we ask that they involved their PAC team. So those staff that are following them that Steven talked about are the ones that can initiate a referral to us if they need to come from home. Any questions about the community living center? I'll move on to hospice.
There are no questions in the chat. Are there any questions from the group? Okay.
Okay, fantastic. So the other program that I work with is our hospice and palliative care program. Everyone's probably aware of hospice, at least a little bit. So this is the program that's involved when a veteran has received a terminal diagnosis and has opted to not pursue any aggressive treatments. We will take care of them through the end of their life. Our goal is to provide them with comfort care, to make them comfortable, to make their transition peaceful and hopefully pain-free. We have a number of different programs within our hospice program. So we do both inpatient and outpatient hospice. Our outpatient hospice is basically a home hospice program. So we contract with community agencies that provide home hospice services. We pay for it if the veteran does not have Medicare, and the contract agency will take care of doing symptom management, pain management, family support, those kind of things, and keep the veterans in their home if that is their wish. If someone cannot be managed at home, we do have inpatient programs, again, both at Lock Raven and at Perry Point. The eligibility for that is simply being eligible for VA healthcare and having that terminal diagnosis with a less than 6-month prognosis. So there is a doctor that has said the veteran has less than 6 months to live. We will bring them on into our facility, again, provide for all of their care, keep them hopefully pain-free, and make the last days of their lives as comfortable as we possibly can. The 2 units have been around for a very long time. The teams are fantastic that work these units. You know, we have specialized providers, specially trained social workers, chaplain services, specially trained nurses that all work on these units and with these veterans. We have a fantastic end-of-life ritual process. We call it the final salute, to where after a veteran passes away, we do, along with the family, we have the family there, and we just kind of do a remembrance of the veteran. A lot of times the chaplain will speak if requested by the family, and then the veteran is escorted. The veteran's on a flag-draped gurney, and they're escorted to the funeral home that is going to take them, both by the staff and by the family. And it's a lot of our families appreciate the fact that that is done as kind of a final way to honor them. Yeah, I don't think there's anything else about hospice. It's a sometimes an uncomfortable topic, but it is a very worthwhile program that you know, really supports our veterans and their families in their final days. Any questions?
Thank you, Heather. I'm going to open it up to the floor for questions.
Dana, I have a question.
Go ahead.
Thank you, ma'am, for your presentation. Is there any help for families who may be short on money or having hard financial wherewithal to visit the loved one during hospice?
So we will do everything we can. We don't necessarily have funds available, but we do have resources available. And so we have worked with many different organizations, Red Cross, Honor Flight, all of those things to kind of help families get to their veteran. So yes, but no, not necessarily directly from the VA, but our social workers are well versed in resources that are out there to help.
Thank you.
Mm-hmm.
Any other questions for Heather? Okay. At this time, we'll go ahead and transition to a briefing from Josie Dean on hospitalization and discharge planning. Josie?
All right, can you hear me okay?
I sure can.
All right, hello everyone. My name's Josie Dean. I'm another one of the assistant chiefs of social work at the VA Maryland Healthcare System, and I supervise our medical and surgical social work staff. I'm going to talk a little bit about what to expect during a hospitalization and kind of the family supports available during hospitalizations. So veterans are typically admitted to the hospital under one of two situations, either as an elective admission for a planned procedure or surgery, or through the emergency department. Elective admissions allow for the benefit of anticipating needs and planning ahead to some extent, whereas admissions through the emergency department are usually unexpected and they tend to bring with them greater uncertainty for the veteran and their family. On admissions, veterans are assigned to a treating team, and that healthcare provider on that team completes an initial history and physical assessment. The nursing staff also complete an initial assessment on admission. Other disciplines become involved in care if and when it's needed, and that may include speech, physical, or occupational therapists, wound care nurse specialists, respiratory therapists, and other consultants. Physicians round on a daily basis, typically in the mornings, to assess each patient and to review and make any necessary adjustments to the treatment plan. Each inpatient veteran has an assigned inpatient social worker and nurse case manager, and those staff participate in daily interdisciplinary rounds with the doctors and assist the medical or surgical or psychiatric teams with care coordination and discharge planning needs that may arise. If a family member has concerns or questions for social worker or nurse case management staff, they can alert any member of the healthcare team to ask for social work follow-up. Social workers and nurse case managers will communicate with veterans and families to help address needs and work through concerns or barriers to a safe and timely discharge from the hospital. The length of stay in the hospital tends to be rather brief for most patients, so discharge planning begins at the time of admission to help ensure that the veteran is able to move along to the right setting when they're medically stable to leave the hospital. When patients have recommendations for placement into a skilled nursing facility for rehab, or for those needing a placement into a nursing home or an assisted living setting, the inpatient social workers work with the veteran and family to discuss options and make referrals to facilities. When a veteran requires home skilled nursing care or home physical or occupational therapy for a period of time after their discharge, the nurse case manager would help arrange those services. There are eligibility criteria for these different types of care, and the veteran's needs must support the actual referrals being made. For example, in order to be placed in a subacute rehab setting, in a subacute rehab facility, there must actually be a verified need for subacute rehab and an ability to actively participate in subacute physical and occupational therapy. So it can't just be, per preference. There has to be a medically justified need for it. Social workers will also educate and assist families and veterans with VA or community resources for a range of different types of needs, including things like Meals on Wheels referrals, information about some of the programs we've heard about already, home health aid program, adult daycare programs, or other community-based programs such as SNAP, formerly known as food stamps, or Maryland Energy Assistance programs, if those are the types of resources needed. Inpatient social work staff remain available if there are needs related to the hospitalization that arise within the first 2 weeks after discharge. Thereafter, veterans and families would reconnect with their assigned primary care team social workers for routine outpatient social work needs. If the veteran transitions to a nursing facility hospital, then that facility's social worker immediately takes over as the primary social worker for the veteran. If veterans are and able to make their own healthcare decisions, then they will be the primary person the medical team and other staff communicate with during the hospital stay. If a veteran wants a certain family member contacted with updates or to help review options or make decisions about discharge planning, then the veteran would need to give the inpatient staff permission to reach out to communicate. If the veteran does not desire information be shared with family, then staff members have to honor that and cannot give family any specific information regarding the veteran's plan of care. But in those circumstances, the staff can receive information from the family, and staff can also provide general information regarding VA programming and resources to educate family members. If a veteran lacks capacity to make their own healthcare decisions, then their durable power of attorney for healthcare, as indicated on their advance directive, is the point of contact that the staff would communicate with. If a veteran who lacks decision-making capacity has no durable power of attorney for healthcare assigned, then their legal next of kin, based upon the VA's informed consent policy, which is similar to the Maryland surrogacy laws, that would be the person that the VA staff would speak with. Hospital staff cannot manage many requests coming in from multiple family members for updates, and they will ask that the family identify a spokesperson to be identified, and that person shares information with other family members, that they disseminate the information throughout the family. To help ensure that information security and to confirm the identity of the caller, our facilities have developed a password system that the family spokesperson is given to use as their verification of identity when they call in. Family meetings can be requested by the veteran, by the family, or even by the treatment team to get all the necessary people together for important updates regarding the treatment plan or to discuss goals of care or discharge planning. So a few frequently requested resources or supports that we often are asked about in the hospital setting, I wanted to give a little information on. The first is assisted living facilities. So assisted living facilities are a level of care between independent living and nursing homes. They are a private pay level of care. Insurances, except for the rare situation where someone may have a long-term care insurance policy, insurances don't cover assisted living facilities. Costs can vary greatly depending upon the location, the amenities, the size of the assisted living, and the level of assistance that's needed by the person entering the facility. Monthly costs can easily be upwards of $4,000 to $6,000 in a large assisted living facility with extensive services and or that's treating higher level needs, people that have greater dependence. Charlotte Hall State Veterans Home is one option that offers assisted living level care to veterans at a cost of 90% of the veteran's total monthly income. VA community residential care and medical foster home programs are programs that inspect and approve facilities that join the program, and they have a VA social worker that visits the facilities on a monthly basis to check on the well-being of veterans in those programs. However, the costs for the medical foster homes and community residential care facilities, those are not paid by the VA. Again, they're a private pay for the veteran to pay, and they start around $2,000 to $2,500 per month out of pocket for veterans. Some veterans may meet criteria for the non-service connected pension and aid and attendance to help cover some of those costs. But either way, it is still an out-of-pocket expense for the client. There are limited community resources in the form of ALF subsidy programs that some veterans may be eligible for through the county departments of aging. And there are many assisted living facilities in counties across Maryland that can be considered. Important factors that patients and families must consider when reviewing options are the level of care that's provided in the facility, whether that meets the level of care needed by that veteran, and also what the veteran's available budget is for care. Another question that we're asked about frequently is Medicaid eligibility. Some of our veterans that have a very low income and very few assets may qualify for community medical assistance coverage, which can help fund additional resources outside of the VA system. Others who are not eligible, for veterans who are not eligible for placement into the VA nursing homes based upon not having a high enough service connection, may also need to apply for long-term care medical assistance when they get to a point that they become dependent upon others for their basic self-care. That happens oftentimes when people are in the hospital and need to go into a nursing facility and don't have the service connection to qualify for placement into a VA nursing home. We do have social work staff available to provide education and assistance in the process of applying for community or long-term care Medicaid, though we always caution we are not employees, obviously, of the state. So we do not have a role in deciding if Medicaid is approved since it is a state program. Other things that we're often asked about are just kind of tangible needs that people come into the hospital needing. Clean clothing to discharge home in, personal hygiene items to make their stay more comfortable while at the hospital, and assistance with coordination of rides home for veterans who don't have means to get themselves home from the hospital. Those are all things that that we address really with the help of donations received through volunteer services. We are often asked about homeless resources and substance abuse programming. Resources are offered for VA programs, VA contracted programs, community programs, or a combination of all three of those. Veterans must be agreeable to referrals. It's important to note neither family members or VA staff can force a veteran to engage in treatment programs. We must respect the individual's right to self-determination while offering information and assistance. Lastly, I know Heather mentioned briefly the hospice and palliative care programs. I did just want to mention We do have a hospice and palliative care consult service here in the acute care setting in the hospital. They are a great resource for people who have a life-limiting condition or who may have complex pain that would benefit from their expertise. We also have a process in place here at our hospital to send timed bereavement mailings out to the families of our veterans who have passed away while here at the hospital. And so we do that on an ongoing basis for the first year after that person's death to just support their loved ones. Social workers are also able to help family members link to community resources for grief support, counseling, and other support groups as needed. So if there are no questions, I will turn it over to the next person.
Does anyone have any questions for Josie before we move to Jackie?
I have a question, Dana.
Go ahead.
Thank you, ma'am, for your presentation. If a veteran has a mental health issue and they're not realizing the need for medical care, for a referral to a specialist, who steps in to make that decision?
So if they are you talking about if they lack decision-making capacity?
Yes, ma'am.
So if the person is determined to lack decision-making capacity at that time, then if they have an advance directive document naming a durable power of attorney for healthcare, would be the person that the providers would go to during that person's incapacity. If they later regain capacity, the person would take back over their own decision-making. If they do not have a durable power of attorney for healthcare naming someone, then we would have to go by the VA's informed consent policy. It is similar to Maryland's surrogacy law regarding essentially going to the legal next of kin. So if that veteran had, assuming that they didn't have a durable power of attorney for healthcare and assuming that they didn't already have a court-appointed guardian in place, the surrogate decision makers would thereafter be, if they're married, it would be a spouse. If they're not married, it would be the combination of all adult children. Then you would go to parents, and you kind of continue down the list to the sibling group and everything. There's a hierarchy based upon, the blood relation, the proximity to that person.
Thank you, ma'am.
Sure.
Josie, I have a question. This is Dana.
Sure.
And I know that you were kind of focusing on the discharge piece, but if a veteran has been admitted into the ED at a community hospital, and perhaps they've actually been admitted to the community hospital from the ED, but it's disclosed that they are a veteran, and how does that work if they want to request transfer to a VA hospital?
Sure. So they do need to identify that they're a veteran and request efforts to get them to be transferred to the VA from the hospital. And that hospital then, we have a acute transfer coordinator at the Baltimore VA. That is the point of contact that the community hospitals have to reach out to. They would, communicate with them, provide the necessary clinical information, and request a transfer to the VA through that process.
And is there a certain level of need for transfer? I mean, would there be a particular situation where a veteran would be admitted in a community hospital where they would not be eligible for transfer to a VA hospital?
The first thing that comes to mind is if they no longer require acute care. So if the community hospital is requesting transfer to the acute, our acute setting here at the Baltimore VA, and there's no acute need any longer, if the patient's really stable for discharge, then that wouldn't be appropriate. another thing that comes to mind is there's sometimes not bed availability. As we come out of the pandemic and everything, there were times at most hospitals, VA and community, where things were very full. And so sometimes there's not bed availability to accept patients for admission.
Great, thank you. Any other questions? All right, thank you, Josie. Jackie Adams is going to be presenting now on the VA Caregiver Program. Jackie?
Hey, can you all hear me?
Sure can.
Great. Okay. I think Heather has the presentation, so she may be helping me with this. Well, welcome everyone. We are kind of a hot button program right now. The Caregiver Support Program at the VA is a national program, and we've had some major changes since October 1st of 2020 as a result of the Mission Act. So I'm going to go through this, and certainly Dana has my contact information if anybody has any questions afterwards that you think about after I'm done. Dana, if you wouldn't mind forwarding them to me. So our Caregiver Support Program is actually broken into two different programs. The umbrella piece of it is driven by our mission statement, which is to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. So the vision is to be inclusive in our care of a veteran and acknowledging and assisting caregivers who care for our veterans. We do that through two different programs. As Steven said, Okay, I had some feedback. Can you all hear me now?
Yeah, I think it may have been when Heather was trying
when I tried to share Jack. Yeah, I was trying to share Jack's slides, and I think I messed it up. So I'm not going to do that.
Okay, that's all right. That's all right. Well, thanks. I thought, oh no, my phone's blowing up. Okay. So we really strive to include the caregivers who care for our veterans in the Veterans Care Plan, as well as support our caregivers so that they can care for our veterans. We have two programs. The Program of General Caregiver Support Services, acronym PGCSS, or folks refer to it as the General Program. Any caregiver of a veteran enrolled in the VA can actually receive support services through the General Caregiver Support Services Program, the PGCSS. And then a Program of Comprehensive Assistance for Family Caregivers, that's PCAFC. That's the golden egg that a lot of folks want because there's a stipend attached to it for the caregiver. The stipend, if approved, the stipend goes directly to the caregiver, not the veteran. There's a lot of eligibility requirements for that particular program and a pretty intensive application process. The benefits, the education and support benefits that our general caregivers receive also convey to our caregivers in the comprehensive program, or some people refer to it as the stipend program. But then there are additional benefits for those caregivers in the comprehensive program. If you have some free time, please go to our website. It's www.caregiver.va.gov. It has a lot of information on there. I think Dana might send out the slides. There's some contact information for you. You can reach out to me. We have a general caregiver phone number at VAMIC, so we'll get back to you if you call that number as well. So I alluded to education and support. We are a comprehensive program. We really focus on working with our national partners in regards to education and support with evidence-based services to our caregivers. Those enrolled in either program, they're free to those caregivers. We have local services. For example, we have a support group, a monthly support group. We just actually finished up. We had a COVID education group for our caregivers. We just finished that this month. And then our occupational therapists in the program have just started an education series for our caregivers. We also have trained social workers who provide some of the evidence-based services supported by our national office. There's one called REACH, and we're also starting, it's called Caregivers First, which is an education support series for caregivers. So we have a lot of events, a lot going on for our caregivers. So our general program, basically, a caregiver can enroll. There's no application process. They enroll. As long as they're caring for a veteran who is enrolled in our VA healthcare system and needs any kind of personal care services. So we have no formal application. We will ask the caregiver if they're willing to share their personal information so we can open up an electronic chart on them so we can document their participation in our education and support services. They don't have to, but we encourage that. We have 2 staff dedicated to the general program. Ashley Jeffries is our senior social worker, and Hillary Wiseman is our coordinator for PGCSS. I know most of you know our main number, 410-605-7000. Our extension for PGCSS is 55248. That will be in the slide presentation. If a caregiver wants to just leave a message, we'll get back to them, send them out information, and enroll them if they're interested. Our comprehensive program, or PCAFC, has a very intense eligibility and application process. So prior to October 1st, the PCAFC program worked with caregivers who cared for veterans who served on or after September 11th, 2001 and sustained a serious injury during their service. Okay. Effective 2001-2020, the eligibility service dates changed and some other eligibility standards changed. So now we are able to serve in that program caregivers whose veterans not only served after 9/11, but also those who served on or before May 7th, 1975, and have sustained a service-connected condition during that time. We are phasing in the new criteria. So it would be on October 1st, 2022, then the rest of veterans who served between May 7th, 1975 and September 11th, 2001 could apply and potentially be eligible for this program. So it is a phased-in process. The basic criteria that I want everybody to know is that a veteran has to be at least 70% service-connected. It can be through one injury or illness or several, as long as it's a total of at least 70%. They have to serve during the eligibility dates for now. And they have to meet the eligibility criteria that shows that they have a need, that they meet the threshold for need in this program, which is actually pretty high, okay? So for caregivers who need personal care services to take care of, like eating, bathing, grooming, toileting, ambulating. Those are activities of daily living. And for those veterans who need supervision, protection, or instruction based on a functional disability. So those are pretty high standards. So I guess what I want to give you an example. We get a fair number of applications from veterans who have back injuries. They have good days and bad days. Good days, they can complete all of their activities of daily living. Bad days, they may need assistance with showering to wash their lower extremities, or some help getting on their pants or their undergarments because they can't bend over. That is not what this program is designed for. This program is designed for veterans who need assistance every time they do that activity of daily living. So, for example, somebody who, who may need assistance with showering every time they shower, and need assistance washing their lower extremities every time due to a functional disability, okay? Or another example would be if somebody is able to utilize aids, assisted devices, like if somebody's not able to ambulate, but they're independent because they can utilize a wheelchair or a walker, that would not qualify for this program then, because they have the means to be independent. So we are looking more at a moderate to high level of caregiving for these veterans applying for our program. So I know there's always lots of questions about that. I hope the examples were helpful with the activities of daily living. Now, supervision, protection, and instruction. So, for example, we could have an older veteran who met all the criteria, maybe a Korea-era veteran who is 100% service-connected, who has dementia. Maybe it's the beginning of dementia, it's an early stage, and they're still able to take a shower or to feed themselves, all right? And then you compare that to a Korea-era veteran who has advanced dementia and cannot figure out how to take a shower, needs to have the caregiver with him at and give every concrete step about how to pick up the soap, how to put it on the washcloth, how to turn on the water so they don't burn themselves. So that's a difference in the level of caregiving that's required to keep the veterans safe. So our program is designed to assist the caregivers who are working with veterans with a pretty high functional impairment level, who may need supervision, protection, or instruction to remain safe. Okay. So for this, there is an application. It is called a 1010CG. If caregiver and veteran go on our website at caregiver.va.gov, they can apply right there. Applying online, we get it immediately. There is also our Health Eligibility Center. They can apply by phone through them or send it to them, and then they'll forward the application to us, or they can mail or hand deliver the application to us at the VA in Baltimore at 10 North Green Street. Since the pandemic, we are not in the office as a full team. We do have daily coverage, so somebody should be there from our program. If they're at lunch or they stepped out, we do have a locked box in the waiting area that folks can drop their applications in, and we check that box every day. They can also fax that to us. So that'll be in the slides that Dana will forward to you all. So I do want to kind of share the assessment process so that when you're talking to caregivers and veterans, they're not caught off guard about the intensity of the application process. This is a clinical program, right? So, and it's through the Healthcare Administration for VA, not through the Benefits Administration. So we have the application process, and we do many steps. And the application process is supposed to take 90 days or less. What would be helpful? Some helpful hints for the veteran and caregiver. If they are getting any kind of community healthcare services, and those providers in the community could demonstrate by their documentation the level of involvement for the caregiver that's needed, those community notes would be very helpful for our review team. So we always encourage our veterans and their caregivers to obtain and send in or fax to us their medical records from the community that would assist in this application process. We start off with a review of the application. We do an intake with the veteran to make sure that he or she meets the very basic administrative criteria, eligibility criteria. Then we do an initial assessment with the veteran and one with the caregiver. In this program, a veteran can have one primary caregiver and up to 2 secondary caregivers. The primary caregiver would be the one that would receive the stipend if approved. And then we have our clinical assessors who, for VAMICs, or occupational therapists, they do a functional assessment with the veteran. All of this right now is done virtually, either by phone or video for now because of the pandemic. And after we do get back to full speed, we will still offer the virtual functional assessment because that either can be done at a VA facility or virtually. We also collaborate with the veterans primary care team, and we package all that up, and it is then reviewed by our regional office, that's called a VISN, by a VISN review team. We call them CEAT, C-E-A-T. So they actually review all of the records. They have access to the VA electronic health record, the community records, and the assessments that we've done. At that point, they will make a determination whether a veteran can proceed with the eligibility process or the application process, or if they do not meet the threshold required of the regulation. And if they don't meet it, then we're done. We inform the caregiver and veteran. They have the option to appeal. We have 2 appeal levels. The appeals go through our regional office, our VISN. If they are approved to continue on, then there is a home care assessment by our clinical assessors. That for now is done virtually. Eventually, it'll be done in person. And that's done with the veteran and then with all of the applying caregivers. And then it goes back for another review by our CEAT team. They determine if the veteran and the caregiver meet all of the regulatory criteria for the program. And if they do, then we are notified and we initiate all of the notifications that start the stipend. We have 2 levels of care, the level 1 and level 2. Okay, so level 2 is for veterans who are determined to be unable to self-sustain in the community. Level 1 is for eligible veterans who are not determined to be unable to self-sustain in the community. So the way the stipend works, that's why we do level 1 and level 2. So the stipend is based on the GS pay scale of a grade 4 step 1, inclusive of locale pay. So a level 2, which is our highest level, the caregiver would get 100% of that at a monthly rate. For those who are level 1, they would receive 62.5% of that monthly rate. Okay. There are additional benefits for the caregivers. Some of them include mental health services through the VA. We are ramping up our respite services, which are separate than from the regular geriatric respite program. We also, our caregivers in the PCAFC program, for example, get access to the commissaries in the PX. We have identification for them to do that. Okay. I do want you to remember that the stipend is for the family caregiver, right? It is for the person that's been approved to be the primary caregiver. It is not intended for the veteran to hire somebody outside. So that funding is strictly for that caregiver. We have situations where we have veterans that already have a home health aide coming into the home through the VA. We cannot pay twice for the same service. So if a family caregiver is approved for the PCAFC program and there is a home health aide already situated providing services, there may be a reduction in home health aide services based on what level a veteran is approved for in PCAFC. So just want to give you all a heads up about that. We do talk to the veteran and caregiver at the beginning of the application about that if they already have home health aide services in place. We also are required by law to reassess the veterans that were already in the program before October 1st. And we're supposed to have that done by September 30th of this year. We are not able to do that, and our national office is looking at getting an exemption for that. And the reason is when we opened October 1st, nationally, we were slammed with applications. Of course, that's a large population, and it's an aging population. So for now, the program nationally is really focused on working through and getting the assessments done for those who are applying. I would say locally, it took us, with the help of paying staff, social work staff outside of our program to do overtime for us, it took us roughly 5 months to get caught up with the backlog of applications. And we have some medical centers across the nation that still have a significant backlog because of the number of applications received. Okay, so that's pretty much the crux of it. Does anybody have any questions for me?
Thank you very much, Jackie. I thought that I had your slides, but for whatever reason, I couldn't find them. But as you were speaking, I was sharing my screen and I was going to the various fact sheets on the stipend and the application process and all of that. So I was trying to follow along with your presentation and sharing the website. So they did get some visuals.
I'll send that to you, Dana, and if you want, go ahead. Feel free to send it out to everyone.
Great. Any questions from the group?
Wow. Okay.
I know, it's so quiet.
Oh, I know. That's wonderful. I don't know if that means I bored them to tears or the presentation was thorough.
Well, in my humble opinion, it was very, very thorough. All four of your presentations were. Any last minute questions for any of our VA presenters this morning before we move on to our round robin? All right, with that, I am going to go ahead and stop the recording.